Next, in this session, we will talk about consults. So in order to get into consults, you'd click orders, you'd click the add folder, and then there's a folder called consults. Okay, and in this folder are common consults. So let's say we wanted to consult cardiology, and here it says stat versus routine. Most of the time you would select routine. And you'll see maybe for practice purposes we want to consult hospice. And I'd put in routine here. Click OK. Click done. Okay, and so here these two orders are coming up. They're identical. We just have to make sure we answer the questions correctly. So for cardiology, maybe I want to put in search for a doctor. Click search, and you might want to type in the name of the doctor. Let's say, for instance, test. And notice there's test doctor. In case you didn't know which doctor, you'd want to, in the real scenario, you'd want to put in the last name of the real doctor, and then it will bring up that doctor. Called status means did you call the person you are consulting? And most of the time you want to say, yes, I called, and make an attempt to call, because that is what policy is. All consults must be having a direct phone call to the consultant, physician-to-physician discussion. But if you didn't call, or let's say it's midnight or something, then you should rightfully say not called, and the next morning it's your responsibility to then call. So here you'd say called or not called, determine called, and here you would put like new onset AFib, chest pain, positive troponin, any kind of reason for consulting. So, and then the next order, if you click on it, consult hospice, same thing. I'd put in, let's say I put in test, and I have multiple matches. For the sake of privacy, I will not name any physicians, but just for test, you'd put in the person you're consulting, and once again, called or not called. Maybe you didn't call this person, and say for medical management of diabetes, hypertension, AFib, and click sign. And so that's how you would place consult orders. And please, to reiterate, it is policy to make a phone call to the person that you are consulting and have a physician-to-physician discussion. That is policy. Thank you.